Hi, I'm Kenneth,
And I'm Danielle.
and we'll be covering how to help clients transition from cannabis to CBTI. Let's talk about something we're seeing more and more in clinical work, which is clients using cannabis to help them sleep. This is one of those situations where if we're not careful, we can accidentally create ruptures really fast. Because from the client's perspective, cannabis works. They fall asleep faster, it quiets their thoughts, and for a lot of them, it feels like the only thing that helps. So when we come in and say something like, you should probably stop using cannabis for sleep, what they hear is, take away the only thing that's working. So today, I want to show you how to approach this differently in a way that is non-judgmental, collaborative, and actually effective. We're going to focus on how to shift clients from cannabis-based sleep to CBTI using practical interventions and language that you can use right away. First, we need to understand why cannabis has become such a sticky sleep solution. The research shows that cannabis can help with sleep onset in the short term, but over time, a few things can happen. The body can develop tolerance, sleep quality becomes more disrupted, and when clients try to stop, they experience rebound insomnia. So, what starts out as a helpful tool becomes part of a reinforcing cycle. You can conceptualize it like this. Client has trouble sleeping, uses cannabis, falls asleep faster, body adapts, sleep worsens without it, uses more cannabis, cycle repeats. And more importantly, insomnia itself is one of the main reasons people continue using cannabis. So clinically, this is not just a substance use issue. This is a sleep disorder being managed in a way that becomes self-maintaining, and that shift in framing matters a lot. Because if we treat it like we need to stop the cannabis, we miss the underlying driver. But if we treat it as we need to repair the sleep system, we're actually targeting the root of the problem. This is where CBTI comes in. CBTI is considered the gold standard for insomnia, and what's really important here is that it doesn't just improve sleep, it also reduces reliance on substances like cannabis. There's research showing that when you treat insomnia directly, sleep improves, cravings decrease, and cannabis-related problems go down. So the goal is not abstinence first. The goal is build a sleep system that doesn't require cannabis. And something that's really important clinically is expectancy. A lot of clients genuinely believe I cannot sleep without cannabis. And if we don't address that belief, CBTI won't stick. So we need to do both behavioral interventions and cognitive motivational work around sleep beliefs.
Let's get into what you actually do in the session. I like to think of this as six-step framework. Step one, validate before you intervene. This is non-negotiable. If you skip validation, you will get resistance. Say something like, it makes sense that you're using cannabis for sleep because it does help in the short term. A lot of people find that. Why, what this does is reduces shame, reduces defensiveness, keeps the alliance intact. Step two, map the sleep cannabis cycle. Make this invisible visible. Draw it out or say, what I'm hearing is you use cannabis, fall asleep faster, but over time your body starts to depend on it, and then the sleep gets harder without it. Then ask, does this fit your experience? Let them confirm it. Don't force it. Step three, reframe the goal. This is where you pivot. Instead of let's stop cannabis, say, what if we focus on improving your sleep so that you don't need cannabis in the same way? This lowers fear. Step four, introduce core CBTI skills. Don't overwhelm them. Start with 2 to 3 interventions, such as stimulus control, saying if you're awake in bed for 20 minutes, get up and do something low stimulating. Why? Break this association between the bed and wakefulness. Looking at consistent wake times, if you sleep in bed, wake up at the same time. Why? This stabilizes the circadian rhythm. Finally, introduce gentle sleep restriction. Limit time in bed. This is important as it frames carefully so it doesn't sound punishing. Step five, gradual cannabis taper. This is where a lot of therapists mess up. Don't say stop using cannabis. Instead, stabilize use, then taper slowly. Research supports gradual reduction while CBTI is introduced. Examples: delay use by 15 to 30 minutes, reduce dosage slightly, um, skip at least 1 to 2 nights per week. Frame it as we're just experimenting with giving your body a chance to take over again. Step 6, cognitive work. Underrated but critical. Target beliefs like I can't sleep without it, or if I don't sleep, tomorrow will be a disaster. Use gentle Socratic questioning. Has there ever been a night you slept without it, even a little? We're loosening rigidity, not arguing. Now we'll be providing you a little role play.
I literally can't sleep without weed. I've tried it before and it's miserable.
Yeah, that makes sense. When your body gets used to it, trying to sleep without it can feel really uncomfortable. Can I ask, when you've tried it before, what usually happens?
I just lie there for hours. I get anxious and then I end up using it.
Yeah, that actually fits really well with what we know about how this works. It's not that your body can't sleep, it's that it's gotten used to needing cannabis to do it.
So what am I supposed to do? Just suffer through it?
No, we're not going to do that. What I'd like to do is build up your natural sleep system. First, you're not going to just lie there struggling.
How?
A couple things. First, we'd actually change what happens when you can't sleep, like getting out of bed instead of staying there frustrated. Second, we'd set a really consistent wake up time so your body starts regulating itself again. And at the same time, we'd gradually shift your cannabis use, not removing it all at once.
So I can still use it?
Yeah, for now. We're just going to slowly make it less necessary. The goal is that over time, your body takes over the job of helping you sleep.
That feels more doable.
All right, so on a quick note, if you're working with a client that has trauma or PTSD, this becomes even more important because cannabis is often being used not only for sleep, but to manage hyperarousal and other symptoms that they may be experiencing. And while it helps in the short term, it can actually maintain both sleep issues and reliance issues over time. So CBTI becomes a really powerful intervention tool here. Final takeaways include treat the insomnia, not just the cannabis use. Don't remove, just replace. Go gradual, never abrupt. Pair behavior and cognitive work. And if you do this well, you're not just helping improve sleep, you're helping clients regain a sense of control over their bodies again. Thank you.